Hello, my name is Rebecca Herr. I'm the president of Alder Boulder, which is the Association of Late Deaf and Adults Boulder chapter. It's a national organization for people who became deaf after acquiring their first language by speaking and listening. Okay, doesn't mean late deafened confuses people. It doesn't mean you got deaf when you got old. It means you got deaf after you learned language. Okay, so I happen to be both. I got deaf when I got old, and anyway, I was diagnosed with hearing loss in 5th grade. Nothing happened. I continued on in school, getting A's and B's. So, where's the problem? Then in high school, I started to notice social awkwardness. My hearing was tested again. I had a mild to moderate loss. I thought at that point that my social problems had more to do with my weird personality than anything else. I didn't realize till years later that hearing loss can affect your social interactions. So I'm a Colorado native. I was born in Colorado Springs, raised in Denver. I graduated from East High School in 1973. And I moved to Boulder in 1973 in that fall to go to college. I graduated in 1980 with a bachelor's degree in anthropology and Latin American studies, with a whole lot of classes in journalism also, so I learned how to write. Let's see, in 1986, I received a master's degree from the University of Texas at Austin in Latin American studies, specializing in linguistic anthropology, which means I know how to read ancient Maya hieroglyphic writing. I returned to Boulder, got married, had a daughter, and worked the rest of my adult life. My daughter was born in 1981. Her birthday was yesterday. She's 38. She's healthy and happy. I was divorced in 1989. I had a marriage with domestic abuse. Happy to be out of that. Financial stress has been my life since then. I came to Boulder middle class. I'm now poor. I live on Social Security disability income of about $15,000 a year, which gives me the buying power of an employee with $7.27 income. I worked in book publishing all of my life. I was a book editor and production manager. I loved the written word, and that has been my life. And that's something that I could continue to do no matter how deaf I got, and except for telephone work. That ceased somewhere in the mid-90s. I couldn't hear on the telephone enough to keep people from getting angry with me. My industry collapsed in the late 90s because of internet, video games, cable TV. Nobody wanted to buy books anymore. So at age 50, I had to find a new career. And that didn't go so well. For 2 years, I worked for the Colorado Commission for the Deaf and Hard of Hearing under the first director. And my job was to do research and writing to build up resources for the commission for their outreach work. I loved that job. I learned a whole lot more about hearing loss at that job, and I met some wonderful people. I was exposed to sign language every day. I started learning sign language in 2002 at the ripe old age of 47. And signing is not my first language, and I still prefer English. I tried changing careers after publishing collapsed, trying to get into disability services. That didn't go so well. After the job at the commission ended, I looked for a job for 2 more years, failed completely, went on and applied for it and got Social Security disability. I didn't feel that I was too disabled to work, but I recognized that needing an interpreter to work in a 20th century skill set of caring about English grammar wasn't getting me very far, so I gave up. And I started doing extensive volunteer work. As the president of the Boulder chapter of the Hearing Loss Association of America, I received grants to do hearing loss outreach in Boulder County. Then later, as the president of the Alder Boulder, with the late deaf and adults, I've gotten more funding to continue to do education and outreach work. The reason I learned sign language was so that I could continue to go to classes and lectures and participate in hearing society, even though I'm a hearing person who can't hear. okay? I have 3 identities: late deafened, hard of hearing, and a hearing person who can't hear. I am not a member of the deaf community. I don't fit in well in the deaf community. Many people in this room can attest to that. I am a late deafened person. We're not deaf, we're not hearing. We're somewhere in between, and we're too far gone for a lot of hard of hearing people. Family history, mental health history. I was diagnosed with depression in college. That's my second disability, and I tell people on any given day, it's easier to deal with being deaf than being depressed. And dealing with being deaf is hard. So, with my family, my mother grew up with an abusive mother and no father. My mother and I have had a very difficult relationship. Chronic low self-esteem on my part, and a lot of criticism on her part. She was an injured woman and never recovered. She has undiagnosed, untreated mental illness. It affected the entire family. She died in 2015. After that, I felt a bit of peace because I didn't have to wonder anymore if my mother would ever like me. So I have seen what happens when people don't get behavioral health care. I have a younger brother who's living on SSI for mental illness. I have an older brother who also has undiagnosed, untreated hearing loss. He's a full-time caregiver for my father, age 94. I'm very concerned about the caregiving my father gets. We think my brother is an opiate addict. He needs help, but he will refuse to get it probably till the day he dies. Another impact. On the flip side, I've seen the impact when people do get the help that they need. I've gotten counseling since I was in college. After years and years of counseling, I understood my family dynamics and I understood how to deal with it better. I learned, and it really helped, and I had a better life because of that. That experience has taught me that everybody's got a secret something that they need help with. But my path was tricky because I had to teach every therapist what it's like to be hard of hearing. Nobody knew that before I came and taught them. So that added more stress. But on the flip side, I was able to finish college, get a master's degree, have a good career, and contribute to society. I'm proud of that. Looking back, I'm proud, but I struggled and I was held back a lot. My younger brother has had a very different trajectory, and I've seen what happens. He has had years of therapy, but he's smarter than all of his therapists, and he keeps going off his meds. So anyway, I've seen how it doesn't work. Okay, behavioral health intervention dramatically improved my life. Many people need to know that there are paths out of personal pain. We can live better lives. I wish my family could have avoided the pain that we had. Let's see. I keep up my self-esteem now by volunteering and giving to the community because I feel strong because people have given to me. This is really important. I live a life filled with gratitude. People have helped me every step of the way. Total strangers have helped me. Even this week, someone gave me a hug when I found out my daughter was stealing money from my disability account. And a total stranger gave me a hug, and it really helped. I have needed people outside of family my entire life to put me back together. The gratitude that I feel is for all of the people who helped me along the way. Following my dad's example, I try to give out kindness and support and good humor whenever I can, because it's a hurting world out there and people need support. We need more kindness and support so that more people can survive the issues that come up when you have hearing loss or family dynamics that are troubled. It's a weird intersection of those two things. Many of the people who have helped me are gone now. I keep working when I don't have to. I work for free because all these people help me, and I need to pay them back. I need to pay my community back. Here's what we need as people with hearing loss, and I'm speaking specifically hard of hearing and late deafened, people who are not born deaf but became hard of hearing or deaf later in life. We need two things. We need help in adapting, first off, learning how to live If you were a hearing person before, you have to learn differently how to live as a person with hearing loss. That's the first thing we need. And if we do that, we can get over the hump. The second thing we need is ongoing support, so that as different trials come up in our lives, we are better able to deal with those. This needs to be mainstreamed into medical care. No audiologist teaches this because there's no revenue stream. I believe it belongs in behavioral care. If we had therapists who said, oh, okay, you're hard of hearing or deafened, we're going to put you into our hearing loss adaptation course. That's going to help. And if we have therapists that are trained in hearing loss issues, that's going to help. But it needs to be a mainstream part of healthcare. I pieced this together by going to monthly meetings of the Hearing Loss Association for like 8 years. You know, that's a long time to learn. I go to conferences. It's expensive. That's a good way to learn. But I don't have the ability in Boulder, Colorado, to go into any therapist who knows how to deal with deaf people. Not one. Okay? I want one therapist in my town I can go to that I don't have to train what it's like to be deaf. The revenue stream, think about this. With 1 million people who are deaf or hard of hearing in Colorado, 95% of them are hard of hearing. The lifetime impact of hearing loss on your income is between $700,000 and $800,000. You know what that is? That's lost revenue for the state of Colorado. That's money that we're not earning and paying in taxes. That means retirement savings, mine, non-existent, none. So this has a financial impact now when people don't get the support they need. It stunts their lives, their jobs aren't as good, they don't get promoted. I know this, I lived it. I don't think other people should have to go through what I did and have to work so damn hard to learn how to live with this. You can live with it, people know how to do it. Connect the dots, let's teach people how to live with this. Thank you.